Thank you.
And sometimes it's outside.
Senator Blumenthal.
Thanks, Mr. Chairman. What I hear is a common theme. Veterans should have choices. Care should be timely, and it should be high quality. The most skilled professionals in the world ought to be available right away, especially in cases of mental health crisis, such as you experienced and your husband, Ms. Marge. And the best laws in the world demand accountability. The VA must be held accountable. And one of the best means of holding it accountable is an effective Inspector General. Would you agree, Mr. Eaton?
Yes, sir.
Firing an Inspector General sends a message on accountability, and it should be accountability not only for the VA, but also for dollars spent on community care. Would you agree with that, Mr. Eaton?
I believe so, yes, sir.
And right now, the Inspector General is barred from that kind of accountability when dollars are spent in community care. And they're scarce dollars. We can't afford to waste them. Whatever we think about the VA, at least there are means of tracking and record keeping there that often is unavailable when dollars are spent on community care. We spend a lot of time talking about VA facilities, wait times, for example. That data is transparent. It can be recorded, tracked, and acted upon, but that's not true in the private sector. Mr. Eaton, would you agree that there needs to be accountability in both the private sector and the VA?
I think when you consider access standards, what we've heard from veterans is even if they receive a community care network referral, they could be waiting perhaps longer than they would within the VA system, that 20-day mark. And so I think there's certainly opportunity to identify how we can ensure streamlined care throughout VA's entire integrated system, which includes the community care network.
That point is absolutely critical, that the wait times for community care actually may be longer in some instances, and we need to guarantee, again, the two systems have to be complementary, not competitive, that veterans are not delayed in the care they receive, because care delayed can be care denied, as Charlie's example shows so dramatically and graphically. And I want to thank you, by the way, Paige, for being here today. I know it's not an easy task to be here, and thank you for telling us, being the voice of Charlie's story. I want to talk about the hiring freeze. The hiring freeze was going to apparently deny positions being filled in VA facilities across the country. Doctors, nurses, attendants, technicians, the people who provide direct care. The administration may have walked back that hiring freeze insofar as VA facilities are concerned. We are still unsure, and clearly the hiring freeze still applies to essential core functions the VA provides. And I'm going to ask you again, Mr. Eaton, because your organization was so instrumental in providing care for Charlie, and your organization and Ms. Mathis provides services for veterans, thousands of them across the country. Isn't this hiring freeze having a detrimental effect on the VA?
Thank you, Senator, for the question. As our team's analyzing the details of the freeze, looking at the exemptions, we note that critical roles like psychologist, social worker, marriage, family therapist, and licensed mental health counselors as of now are listed as exemptions. And so we're going to continue to work closely with warriors to hear their experience throughout the system so that we can step in if and when there's an area for us to support.
But if there are insufficient exemptions, it will have a deleterious effect. I assume you would agree.
Yes, the capacity and timeliness for care is definitely tied to provider capacity.
And the freeze on funding, that affects vital programs, including suicide prevention programs. Just give you one example. Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program provides grants to community-based suicide prevention resources to meet the needs of veterans. You're familiar with it, Mr. Lorraine?
Yes, sir.
Including Easter Seals, for example, in New London, Tolland, and Windham counties in my state of Connecticut. That program now is frozen
Yes, sir.
in terms of funding. That's a bad decision. Would you agree?
I think it freezes our ability. We connect to 235 veterans a week through the Fox grant. That's 235 veterans I can't connect to.
Thank you. My time has expired. I have quite a few more questions, and I hope the chairman will give us a second round.
Senator Cassidy.
Thank you. Mr. Golnick, maybe 3 years ago, we had testimony